Thank you for your presentation. I will present this work on behalf of a student who could not be here. Our main purpose was to assess radiographers' knowledge about infection prevention and control measurements, and also to evaluate its applicability during the clinical practice. Our methods and materials were a self-applied questionnaire about infection prevention and control measures applied to 48 radiographers. This questionnaire had a sociodemographic and infection prevention and control measure questions to evaluate workplace conditions, radiographers' knowledge, and in what situations they use gloves. We also had an observational grid to record if the infection prevention measures were applied. Then we also used ultraviolet light to check the efficiency of alcohol-based solution to disinfect hands after procedures. Our results were, we had a 50% sample of female and almost equal male. Professional experience, most of them had between 5 and 9 years of experience, so fairly low regarding all lifespan of professional work. Ages between 21 and 61 years, the majority of them between 27 and 32 years of age. Results showed that almost 60% of radiographers had training in hospital infection prevention measurements, so almost 40% did not have them. Same proportion of sample responded to use personal protective equipment such as gloves and aprons when necessary. The main reason cited by participants for use of gloves is to minimize risk of biological material handling, potentially infected, with 62% of the total sample. The main reason for non-use of gloves is that they have no perception of risk in certain procedures. The gloves are unavailable on site, in the room, for example, or the urgency of the procedure itself, both with around 27%. During the observation, we recorded that a small portion of radiographers disinfect hands before procedures and apply gloves, but it's more common to disinfect after the procedure. During the evaluation of hand scrubbing technique, only 20% of radiographers presented a total disinfected area of the hands. And in the rest of the sample, the most common non-sanitized areas are the fingers and the back of the hands. So in conclusion, generally radiographers were aware of infection control guidelines, but several of them failed to apply these procedures during radiological examinations. So we think radiographers must be given periodic training in infection control procedures, written protocols and legislations on site, for example, and must be outlined to monitor the use of infection control procedures during work, and there should be a periodic monitoring of practice of infection control procedures by those radiographers. So thank you very much for your attention.